in my Ayurveda Academy YouTube channel. My dear friends, as you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, I am coming on, that means live sessions with some topics like Kayachikitsa. So here we will discuss about the different aspects of the subject Kayachikitsa, that is Ayurvedic internal medicine. And today I am going to discuss with you about the different treatment types regarding the Ayurveda. So the treatment procedures of Ayurveda are divided into the various groups or the angles. The first, the aim of every Ayurvedic Vaidya for proper treatment is first step is to find out the probable causes of the disease, and remove that particular causes whichever possible, which is called as a Sanshepatah Kriyayogo Nidana Parivarjanam. Try to avoid the causes. For example, your hectic lifestyle is causing some problem with your backache. That means you have to take some another alternative which can prevent some hectic lifestyle. You can be a regular person. Then if you are having the habit of eating high calorie food and you are becoming obese and having the cholesterol problem, the first thing, you must be having some control on your tongue. That is called as a nidana parivarjanam. Second aspect of the Ayurvedic treatment is to find out the vitiation of dosha, which vata pitta kapha is disturbed, and also to find out dushya, that is the victim, because these prakupita dosha or the vitiated doshas, they attack on your body tissues and waste products. Dosha vata pitta kapha attack on rasa, rakta, mansa, med, asthi, majja, shukra, whichever the weak tissue in our body. So you have to find out that dushya. Third aspect of Ayurvedic treatment, actually there are doshas we consider at two levels. One, the physical doshas, that is vata, pitta, kapha, that we have to see the imbalance. And at the same time, we talk about psychological doshas, that is excessive raja and excessive tama. Okay? Now, next aspect of Ayurvedic treatment, we have to consider the mind. Ayurveda always says that the physical body and mind are the two sides of the one coin. So we have to consider this psychological imbalance, and that we correct with sattva jaya chikitsa. We have to improve the sattvic quality of the mind, that is balanced, tranquil, satisfaction. And that sattva guna can be increased by sattvic diet and practicing meditation and yoga. We are discussing about the different aspects regarding Ayurvedic management. Also, we can divide the treatment in important two types, that is Naishtiki Chikitsa, which is having some spiritual aspect, Naishtiki Chikitsa, which is for attaining the moksha, that means eternal happiness. And Acharya Charak has explained that we have to follow Sadavritta or Achar Rasayan, that is ethical code of conduct, to get the tranquility of the mind. Because this Achar Rasayan, behavioral code of conduct, can be health promoting, and that's why we have to follow that lifestyle and conduct and the behavior accordingly. Let us talk about another aspect of Ayurvedic management. There are another classification. We treat the patient by using some substances, that is dravya rupa chikitsa. Dravya means specific substance like any tablet, any syrup, any aswas, aristas, churnas. And sometimes we also treat the patient without using any substance. That is called as a adravya rupa chikitsa. For example, we try to do the counseling for especially the psychological problems. We advise some typical mantras in the Ayurvedic management, and that are not the exact churnas or the tablets. That is adravya rupa chikitsa. Now, another treatments are having called as a yukti vyapashraya and the daiva vyapashraya. Yukti vyapashraya, that means with the Vaidya's logical thinking power, with his intelligence, with his experience, he tried to correlate the cause, pathogenesis, and then he advised some management or the treatment. So this is called as a yukti vyapashraya. Yukti is a logical inferences by logical thinking process. And another is a daiva vyapashraya chikitsa. This is something again having spiritual aspect. Mantra, Aushadha, Mani Mangala, Bali Homa. This is Daiva Vyapashraya Chikitsa. Next aspects of our Ayurvedic management, we have to understand because of the aggravation of physical doshas like Vata, Pitta, Kapha, there are sometimes the disease is more having exacerbations, acute attack, and some another days he is having a little bit remission. So relapse and remission, that means bad days and good days in the disease process. For example, if you consider the rheumatoid arthritis, that some months, some weeks, the patient is having tremendous pain, and at some time he don't have any pain. So these particular periods in Ayurveda are called as Vegavastha and Avegavastha. So exacerbation is a Vegavastha, and Avegavastha, that is called as remission. Now, when we try to understand this concept during the attack, the ideal treatment is to break the pathogenesis, that is dosha, dusha, sammurchana. What is that? Vitiated doshas are attacking on the weak dhatus, rasarakta, mausmed, asti, majja, shukra, and that particular amalgamation union is called as dosha, dusha, sammurchana in Sanskrit. We have to break down that pathogenesis. That is like a atyayika chikitsa. This can be done by giving some particular rasakalpas or metallic preparations, or by doing some purificatory procedures. Okay? Generally, Ayurvedic treatments methods are having again the different classifications like Dvividha Upakramas and having the Shadvidha Upakramas. So, two types of the methods and maybe six types of the methods. Don't worry, my dear friends, I am going to discuss each and everything in detail in my next live session, that is Kayachikitsa Live 3. By the way, my dear friends who are on the stage or who are on the platform of this live session of my YouTube, please note that there are subtitles are available in the different languages. So Hindi, Marathi, Gujarati, all people can understand my these lectures on Kayachikitsa. Okay. Now next, what is that two-way treatment? Two types of the methods. One is a langhana and another is a bruhana. So langhana is nothing but what you can say the scrapping or catabolic type of the treatment. When the patient is obese, hyperlipidemia, then we give the langhana. But some are the people having undernourishment. Then we have to give the bruhana treatment, that is anabolic type of treatment, tonification type of treatment. So these are the two main types. One is a langhana, another is a bruhana, that is reduction or the tonification of the body tissues. Now I am explaining you which are the names of six types of the treatment. So these are like the three pairs of antagonistic action, opposite action. First, I have already told you bruhana and langhana, that is tonification and fasting. Next pair is a snehana and a svedana. Snehana is a lubrication or the oleation, and svedana is a sudation or the fomentation. Next pair is a what you can say, the Snehana and Rukshana, one pair, and Stambana and Svedana. Stambana is a controlling the outgoing substances, and Svedana is a removing the waste products from the body like sweat. So once again I repeat, Langhana Bruhana, then Snehana and Rukshana. Snehana is a lubrication, Rukshana is a drying effect, and another is a Svedana and Stambana. Now, next aspect of Ayurvedic management, very important, very special, is the Shodhana Chikitsa or the purification treatment. And there are 5 important measures that is called as a Panchakarma in Ayurveda, 5 detox procedures, 5 purificatory processes, like, for example, Vamana, therapeutic vomiting, then Virechana, therapeutic purgation, Nasya, nasal medication, Rakta Mokshana, that is bloodletting, and Basti, that is medicated enema. Okay, now we will talk about different Ayurvedic management procedure, that is Shamana Chikitsa. Shamana or the palliation is again of 7 types. Of course, once again I am telling you, I am going to discuss all these things in detail in Kayachikitsa Live 3. So for this particular Shamana, we Ayurvedic Vaidyas using the herbs. Sometimes we control the diet regimen. We give the increasing digestive fire, Deepana Pachana Chikitsa. Then we also advise about lifestyle, then yoga, and the Panchakara or massages. In the Shodhan procedure also, try to understand there are some soft methods which we are included in the Shamana procedure. Okay, that means allied Panchakarma, that whatever the, for example, Shadishashtika Pindasveda or the Shirodhara is not actually the Panchakarma, is a palliative type of treatment mainly. Now, for example, for the elevation of doshas, Ayurvedic Vaidya can also use some subtle healing modalities like Sangeet Upachar, that is music therapy, Jema therapy, color therapy, and aroma therapy. So we are talking about Ayurvedic treatment protocols. Next, our method of treatment. Most of the times, this dosha imbalance is of type Sansarga and Sannipat. Sansarga is at a time 2 doshas are in aggravation. Then what we have to do? We have to treat the most aggravated doshas first. For example, there is a Vata Prakop and Pitta Prakop. Naturally, if Vata Prakop is more, we have to treat Vata Prakop at the frontline treatment. Okay. Now, when we are talking about Ayurvedic management, sometimes pathogenesis involves the deeper tissues, that is called as a dhatu gatavastha in Ayurveda. That means the pathogenesis or pathology is attacking rasa, rakta, mans, med deeper and deeper and deeper. So there we have to understand that particular treat the dhatu and dosha altogether, how they are going inside the body. Now, when we say the dusha means the body tissues, rasa, rakta, mans, med, asti, majja, shukra, on which the doshas are attacking. Also, dusha, they include the srotasa concept of Ayurveda, body channels, rasa va srotas, rakta va srotas, mansa va srotas, etc. Then Agni is also dusha because it is also deranged. Then Ojasa, waste product, and sense organ. All these elements of our body are included as a dusha. So dusha means whichever the elements which are attacked by the aggravated doshas. Then here we have to find out which is dusha and how we can recorrect the pathology in the dusha, how we can improve the immunity of that particular dhatu. Now, next, when we talk about Agni, for improving Agni, the pungent herbs are advised, that is called as deepana, like for example chitraka or the trikatu, suntha maricha pippali, because they contain fire and airy elements. Now, next main aspect of Ayurvedic management is understanding of ama. Ama is like a toxin. It can be the vitiated dosha, it can be vitiated dhatu, vitiated malas, and these particular conditions in our body, when these dosha, dhatu, and mala are having ama, then that is called as a samavastha. The particular stage of the disease is with sama, ama, toxins, and the doctor is trying to make the body removing that ama. So that is called as a niram avastha. There is a difference of treatment when we treat the samavastha and when we treat the niram avastha. Naturally, there will be difference. In sama conditions, we have to vaidya should be used hot and penetrating herbs and also the oxides of metals, that is bhasma. While in the nirama avastha, that means doshas are aggravated, but ama is been removed. Then one has to use the bitter herbs containing either ether and the air element. So that is bitter herbs. That is pachana type of treatment. Okay, we will go further. I am introducing the different names, different modalities of Ayurvedic management. The treatment is, for example, there are two types of the diseases: santarpanajanya, that is overnutrition, and second group is apatarpanajanya diseases, that is what you can say the undernourishment. So whenever there is excessive nourishment, that is santarpana vyadhi, we are doing opposite, that is antagonistic apatarpana chikitsa, reduction methods. And when there is undernourishment, we have to give the bruhana treatment, santarpana chikitsa, or tonification treatment. I think you are a little bit aware in getting understanding of the Ayurvedic terminologies, Ayurvedic types of the treatments. Let us move further. Why there is a recurrence of the disease? Have you thought about it? Why there is repeated skin infections? Why there is a psoriasis is not getting cured? Why your simple vasomotor rhinitis, allergic rhinitis is not getting cured? Why? So recurrence of the disease is because of the weak or viguna tissues in our body. And that's why Ayurveda is recommending, whenever there is a recurrence of the disease, Ayurveda is giving apunarbhava chikitsa. Apunarbhava, that means rasayana chikitsa. Okay? So rasayana chikitsa, what we do? We increase the strength and immunity of that particular weak tissue. This is also called as a urjaskara chikitsa. While treatment against any disease is known as the rogagna chikitsa. Rogagna is anti-disease and urjaskara is immunomodulator treatment. In the chronic conditions, the drugs does not reaches at the site of the disease due to the toxins and other waste products. In such conditions, proper purification procedures must be done first, and then rasayana procedures or the tonics or the immunomodulator methods can be adopted. Similarly, Vajikarana treatment is advised for increasing the sexual power or the aphrodisiac or the quality of the Shukra Dhatu or the Ojas. So this treatment should be used in the cases of infertility or for improving the quality of progeny. Next aspect of Ayurvedic treatment is based on Ojas. Oj is a vital essence from all the body tissues. It is very similar to modern immunity concept. Ayurvedic concept is Oj. So this Oj is reduced or gets vitiated, that can create the different complicated and chronic diseases. For example, the cancer, for example, HIV or the AIDS, for example, the tuberculosis or the degenerative neurological problems like SLE, systematic lupus erythematosus, motor neuron disease, etc. In these conditions, the Ayurvedic Vaidyas are focusing on Oj why it is vitiated, and then Ojo Vardhana treatment is given, and Sattvic type of the diet is also advised. So Oja Vardhana, the most important is gold, Suvarna. Even we give the medicated water, Suvarna Siddha Jala is very good to improve the ojas. Now, we will go further. The another classification of the treatment or the management is three types. For example, Antah Parimarjana, cleansing from inside, that is giving the herbs and other medicines orally or by chatana or the different methods. Anna means internal cleansing. Then Bahip Parimarjana, application of the pest. Then massages or the abhyanga, that is external management. Shastra Pranidhana is another method. For example, in some cases, you need the surgery, and Ayurveda understands these problems. For example, tumors are there. So, Shalya is a special branch of Ashtanga Ayurveda. Kaya, Bal, Graha, Urdhvang, Shalya. Shalya means surgery. Danshtra, Jara, Vrishan. Sushrut is a father of surgery, and it is accepted by even modern surgeons. In the modern surgery books, the name of the Sushrut is mentioned as a father of surgery. So this is a special branch. And when we cannot treat at a physical level, Kayachikitsa level, Tatra Dhanvantaryanam Adhikara, we directly refer this patient to the Ayurvedic Shalya Visharad or surgeons. Now, another way of differentiating Ayurvedic management, Hetu Viparita Chikitsa, that means treatment against the particular cause. Vyadhi Viparita Chikitsa, as per the specific disease, and Hetu Vyadhi Viparita Chikitsa. I am giving the examples in my next session. So, my dear friends, in this particular session, I have tried to explain you the different Ayurvedic treatment modalities and different types of classification and different types of aspects. I hope you have enjoyed this live session, and I request all of you to make your subtitles on and such type of the live sessions regarding the Kayachikitsa I am going to do perform on and off. So once again, thank you very much. Take care.